comes from the Latin or the Italian malaria, which means bad air, literally. Because about 120 years or 130 years from now, before the discovery of malaria, people thought that it was transmitted by the bad air. So if you're living in a swamp, which was typically a place where the air was not of good quality, etc., you got malaria, and therefore people associated it with that. Well, that's talking about 25 years ago, or even 30 years ago, when I was working and living in Tanzania. And at that time, I think it's fair to say there was nothing going on. Just nothing. Apart maybe treatment in health facilities with a drug that was failing rapidly, chloroquine. No preventive measure of any form. And the consequence was that malaria was an enormously big public health problem. Very different from what it is today. I think it's really, looking back, makes us realize actually how long a way we have come since then.
Yeah, it's interesting that you say that, because when I started, which is about 15 years ago, I think we had nets being distributed, a lot of IRS campaigns, and the first signs of resistance to the insecticides used in those products. I think there's much more integration of different approaches, and from vector control, controlling mosquitoes, I think there has a lot of change been in developing new tools, new products. For a long time we only had nets that are treated with insecticides and indoor residual spraying. With upcoming resistance to insecticides, now a lot of initiatives to come up with new products, also not only these two tools but other tools as well.
Mm-hmm. As I can see, the huge difference has been with political support, the visibility of malaria, the political support for control, etc. And that's translated into a huge increase in financial resources, because 2000 the world was spending around $40 million on malaria control. Now it's closer to $3 billion. So really a massive difference in simply the resources available, which makes everything else then also possible.
So for entomologists, malaria control is really vector control. That means killing mosquitoes, or at least diverting the mosquitoes from people so they cannot transmit malaria. And we think that vector control is really one of the most important aspects of malaria control.
I think epidemiologists, for us, treatment is of course important, and also making best possible use of all the treatment options that we have, also for prevention, not only for vector control. But I think one thing that we have increasingly really entered into is really a much more health systems approach. Also the support to the government, to all the systems we need to have in place to have long-term and sustainable control, decision making more and more decentralized at community level, etc. So there is a very strong aspect also of really institutional engagement. The answer to that is not entirely straightforward, because we, especially in the very high endemicity areas in Africa, we don't know a lot about COVID because the statistics are not good. And we know also very little about what the real impact has been. But by negative logic, you could say, since we haven't really noticed a very big difference, the difference is probably, or the impact of COVID has probably not been all that strong. And that's reconfirmed by a lot of anecdotal information we have from all our institutions we work with in the field, or our colleagues, etc. There's been some disruption. Some campaigns, for example, for the distribution of mosquito nets have been postponed, but not cancelled. It's just been postponed maybe by 2 or 3 months. Health facilities have closed and reopened. the overall effect is probably not going to be nearly as big as what we had or feared it would be 1 year ago.
I think currently there's really good drive in developing new tools, and if we can keep the commitment of politicians and all the stakeholders, then I think there is hope to eradicate malaria, or at least to bring it to a much lower level than what we have today.
And for my part, I think I'm kind of optimistic, but I don't think I will see it in my lifetime. But I have really a good hope my children will see it.